On campus at the University of Saskatchewan, a team of experts are improving the delivery of healthcare to dementia patients. In 2003, the Rural Dementia Action Research Team, or RADAR team, developed the Specialist Rural and Remote Memory Clinic to diagnose and manage complex types of dementia in people living in rural areas of the province. Patients travel to the memory clinic in Saskatoon to see a neurologist, neuropsychology team, physical therapist, and nurse all on the same day. Because they often live far outside the city, follow-up can be done through telehealth.
When we first started out, no one was really doing a clinic like this anywhere in the world. No one was doing a multidisciplinary memory clinic with telehealth follow-up. So we didn't really know if it would work, but it turned out to work very well.
An effective team approach that needed to reach more people.
One clinic can't meet all the demand for diagnosis of people with dementia in the province, and our goal has always been really to focus on the more difficult, complex cases of dementia. But we realized we were getting a lot of referrals for, more typical Alzheimer-type dementias that guidelines say should be able to be diagnosed and managed by primary care physicians and teams. But dementia not being as common, physicians and other healthcare providers don't develop as much skill and confidence.
So the method developed here expanded into rural communities to make it easier for people to access support at home, like in Kipling, Weyburn, Bengoff, and Radville. The RADAR team worked with primary healthcare teams here to design and run their own local memory clinics.
It teaches them about when to refer to a specialty clinic like ours. When do you get to make that diagnosis in your local setting, and when should you refer? And part of that question, or at the core of that question, really is what is a typically presenting person with dementia and what is an atypical presentation.
Welcome to our clinic.
At a memory clinic in Kipling, the local team starts by discussing concerns with the person who may have dementia as well as their family, like Marjorie and her daughter Leanne. After this, Marjorie sees each team member, starting with a neurological assessment by the nurse practitioner.
And I want you to touch your nose. Perfect.
Then, the home care nurse evaluates her cognitive skills.
Good job.
The physiotherapist does intensive testing, including strength and balance.
Okay, now dial the number.
Functional tests are then done by the occupational therapist to see how Marjorie copes at home doing simple tasks. Meanwhile, Leanne meets with the First Link coordinator from the Alzheimer's Society. At the end of the day, team members discuss their findings and then meet with both women for a diagnosis and care plan.
Sit right beside me.
The opportunity to be doing things in our own community with our own people and giving us a framework by which to work and to make decisions and help clients and families. It's been wonderful.
These one-stop, one-day clinics are making a difference.
This team is absolutely wonderful. The difference that they have made with Mom being allowed to stay at home, living safely and comfortably is amazing.
As a team,
that early intervention and early diagnosis is so very, very important. Having all the training that we have had and put into practice has just made a world of difference.
This tailored team approach with ongoing support from RADAR team specialists is providing a longer-term solution to a growing healthcare issue.
We need that ongoing follow-up and support to make sure that if your needs change, the resources that you need then are available to you. And that's the real advantage of being based in the community. We're hoping that this will spread into other parts of the province.
These memory clinics gives the family hope. It gives the person hope. The more clinics that we have like this, it's only going to benefit people more.